Well, let's go ahead and get started. Welcome, everybody. We are going to start with a land acknowledgement. So who is going to read that for us today?
Carolyn volunteered to read the land acknowledgement today. I did. Good afternoon, I suppose it is already. Can everybody hear me?
Yes.
Yes.
Okay, perfect.
Yes.
We recognize and acknowledge the Indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Danino, Klamath, Molalla, and Yuruskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept of the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Ms. Carolyn. We also want to make everyone aware of our some of our meeting practices. We do our best to avoid acronyms and jargon, kind of use simple language and don't assume that people know what those acronyms mean or the jargon. There's a lot of jargon in healthcare too. So we just want to make everybody feel welcome and hope that you will contribute and participate. And we'll do our best to actually call on folks to give you an opportunity to participate as we move along. But feel free to speak up. You can use the raise your hand reaction under the reactions button at the bottom of your screen, assuming your screen looks like mine. And yeah, just hope you feel welcome. And with that, we're going to do introductions. We keep our introductions limited in order to save time to our CAC members only, and then anybody who is new with us today or who's a guest. And Kelly's going to help us, I think, go through the introductions.
Yeah, I can help you. Okay, so we'll do our CAC members first. Let's do Elizabeth and then Miranda.
Hi, I'm Elizabeth Schmidt. I'm the vice chair and I'm a retired voc rehab counselor. Thank you.
Good afternoon, everyone. My name is Miranda Hill, pronouns she, her. I'm a CAC member and I'm with Klamath County Public Health.
Stacy, then Teresa.
Hi, my name is Stacey Shaw. I'm a CAC member. I'm Cook County representative and also community representative.
Teresa?
You're on mute, Teresa.
Day. I'm Teresa Lander and I'm a community representative for the CAC.
Great, let's do Maida and then Karen.
Thank you. My name is Maida Benitez. I am a CAC member, representative for the community.
Hi, good afternoon. My name is Karen Correa. I'm with Jefferson County Public Health, Health Equity and Education Specialist, and also a CAC member and a community member as well.
And Linda?
Yes, Linda Johnson, CAC member and also a member of the Central Oregon Health Council Board.
Great, I believe that is all of our CAC members. And then we have one guest here today. We have Kimberly Drew.
Do you want to introduce yourself?
Introduce yourself real quick.
I'm Kimberly Drew. I'm the Diabetic RN Care Coordinator here at Volunteers in Medicine.
Kimberly, thanks for being with us. And that leads us right into public comment. So Kimberly, if you're ready to share.
Okay, perfect.
Yeah.
My stories. So we have a lot of our patients are not qualifying for OHP, and we're transitioning them over to St. Charles as well as Mosaic Medical and a couple other clinics around the area, and Sisters here in Bend as well as in Redmond, in Pine Mill as well in Madras. I've had a couple, so I only work with the diabetics and pre-diabetics. So they're the only ones that are reaching out to me because I'm their point person here at Volunteers in Medicine. So they are used to calling me if they need any assistance with getting medications or helping them coordinate, follow up on a referral or anything like that. There's been a few of the diabetics who've transitioned over who've reached out to me because they've had some complications with getting their medications or not sure what to do after their appointments, not sure when their next follow-up is or what happened to their referrals now that they've transitioned to St. Charles. And then I'm prepping my current pre-diabetics and diabetics on how the system works, but I think they might still have some challenges as they navigate through the OHP, now having insurance, and they don't know what is covered and what is not covered. So particularly there was one incident when their patient had a telehealth visit at St. Charles, and he was called in English and no one ever gave them a call back in Spanish, even though they requested a call and they even called back a couple times. So then we switched them over to Mosaic because they didn't want to have any more complications, and Mosaic seems to have more Spanish interpreters readily available. And then I've had a couple of patients requesting help with getting their medications just because now they have to go to an outside pharmacy and they're not sure if their new provider sent them in. From what I can tell, since they have enough medication at the time, they don't have any refills. So I had to call and request for them to refill all their medications, send them to this pharmacy, and then have someone help them with their referrals because they also had some open referrals that they haven't heard about or when their labs needed to be completed and where to go to complete them. So I also had someone give her a call back to follow up on those things with her.
Kimberly, so is it accurate to summarize that the issue that you're raising is primarily language access, or is it more than that?
I think it's more than that. I think it's more of like having someone help them coordinate all these things because the system is very complicated. They need like a point person who they can, it is language, but it's also care coordination in general for these patients particularly. And transport, because they would help them arrange transportation to these appointments, to get the labs, to go to certain referrals and stuff like that. So just having that care coordination available for them and enrolling them in it at the beginning and asking those questions in that initial visit, which it sounds like they don't know anything at all. Like now they have insurance, what is covered? Can help me navigate and get the appointment scheduled.
Okay. So I don't know if Kristen, if you want to jump in, that's kind of your area, I think.
Yeah, I'll have to sort of bring this information back. I took a bunch of notes as you were talking, and I'll have to sort of take this information back. And we have sort of a whole team that's just focused on the healthier organ people, the HOP rollout. So this is actually kind of the first feedback we've received, good or bad. And so we meet, a core team of us kind of meet on a monthly basis to share these types of challenges. So I will reach out to Mallory, who is sort of leading that charge, I suppose, and let her know about this feedback we received today. And then I'll circle back before the next CAC though. Oh, I guess holidays are coming up, but I will do my best to connect with her as soon as possible and have feedback by the next CAC. But if there's anything else that you'd like to share with me, Kimberly, I can make sure you have my email. And
yeah, I think that would be great.
Yeah, and then you can kind of reach me about these issues as they're coming up.
Yeah, because it's still fairly new. These are the first ones that I've encountered, but just based on what I've seen, I'm going back and contacting all my pre-diabetics and diabetics and just kind of helping them navigate it and ask for these services in the meantime so that they're aware. But then that leaves the rest of our population as well to figure it out on their own. But hopefully they'll reach out to us if they need help.
Yeah, so Kristen just put her email in the chat, if you can grab that, Kimberly. And yeah, thanks for sharing today.
Yeah, thank you for having me and letting me share.
And it was not clear, CAC means Community Advisory Council. Community Advisory Council, CAC. But yes, Carmen.
Hi, Kimberly. Sorry, my voice, I'm getting sick here, but thank you for bringing up this issue with the new transition of folks. Do you have a sense of volume at this time? And are there assisters working with them?
So from our side, they are helping them get onto HOP and get an initial appointment. From there on, it is up to the new clinic to help coordinate their care. So they don't have any, I'm not sure if St. Charles has anything. I requested it for that one patient that I knew would really need it. But I don't know if, I can't tell you the volume or anything like that because I don't have that data. I only know it's been like 5 or 6 of my own cohort that I manage so far.
Great, thank you.
And Carmen, I think Pacific Source has like those enrollment numbers that we could share with you. So I can ask Mallory about just the new HOP enrollees since June or July of this year.
Carmen, did you want to say something?
I have a lot to say, but I guess my question is, thank you for elevating this issue. In the meantime, there are families right now, 5 to 6. How do we close the loop on them?
I've called to request the information. Like I've called them to, I personally called St. Charles to request those services for them. And then I told them that if no one got back to them, give me a call back, which they usually do.
Okay, so let us know what we can do.
Sounds good. Like I haven't heard back from them, so I'm assuming whatever they had has been addressed at this time because they're pretty good about contacting me.
And then Kimberly, are you aware that, and Kristen, correct me if I get the wrong wording, but there's care coordinators at Pacific Source, like specifically kind of to work with a client on multiple aspects?
Yeah,
Okay.
we have a member support specialist team that can help coordinate appointments and help people better understand their OHP benefits as well, help them find a provider that's going to speak their language and all of those types of things. So, and we do have Spanish speaking members on that team. I can put the phone number in the chat.
That'd be helpful.
Okay.
Yeah. And I think when I called St. Charles, they said they were going to put that referral in and request that for those patients.
All right. Well, thanks, Kimberly. Appreciate it.
Yeah. Thank you.
You're welcome
guys.
to come back to the next meeting if you'd like, or Kristen can follow up directly with you, or yeah. All right.
Thank you.
Yeah. Any announcements?
Hey, Brad. I'm so
Yes.
sorry. I think she jumped off probably before she saw that I put that number in the chat. Would you mind connecting us by email just in case she doesn't email me?
I got it.
Oh, she's still there.
she's there.
Okay. Sorry. You just
Camera
switched
went off.
positions. Okay. Thank you. Sorry.
Nice. Any announcements?
I just had a question. What is your blood sugar when you're pre-diabetic? The number. Is it 600 or is it?
It usually has to do with your A1C level, which is like a ratio. I should actually wait, did she jump off now?
I think she did jump off now.
Oh, okay. It's usually a ratio of your A1C. I'm not sure what that stands for, to be fully honest. And that's like a ratio over like the last 90 days that lets the provider know the range that your blood sugar has been in.
See, I'm kind of fighting with my provider because I take that test. And I think I'm a little high in that ratio. And I'm starting to think maybe I better start arguing and really cut all sugar out of my diet. So that was my question.
All right, thanks, Elizabeth. Well, let's move on to approving our meeting
Brad?
notes. Yeah.
Just a quick announcement for community health projects. They are out the door, except for one. We just need one little signature, but those funds are pretty much out the door and the projects will begin. So that's exciting.
Awesome. Good job.
And then
There's a lot of
more announcement before we move on. We're having the combined board and CAC meeting next month, and it will be during the usual time for the board meeting. And so that is the second Thursday. And we're going to have lunch together starting at 12, and the meeting will start at 12:30. So more to come on that, and we'll make sure that you all have the calendar invite, and it will be in person.
Will that be in Bend, Michaela, or somewhere else?
I think we're still trying to nail down a space.
Okay.
And as a reminder, we provide transportation support and reimbursement, childcare reimbursement for the in-person meetings. So know that we'll talk to you CAC members here, send you out some materials that we haven't had to use in a little while. So we don't want that to be a barrier.
I'm open to carpooling with whoever as well. So putting that out there. I usually have a fun mobile, so I'd love to carpool with any of you.
Thanks, Karen.
And also public health, we have a community room that all are welcome to. And if you wanted more information on that, Michaela, I could send you an email after this.
In Madras, correct, Karen?
Yes.
Madras?
Yeah,
Yeah.
sorry, in Madras.
That's good. Okay, fantastic. Well, is there anybody who would like to recommend approval of the meetings from November, or are there any questions or any, Linda, you have your hand up?
I'll move adoption of the minutes as presented.
Anybody like to, we kind of go through, actually, we don't have to do the first and second. We're trying to get away from the Robert's rules on this committee. So no need for first and second. So let me put it this way. Is there anybody who has any corrections you'd like to make or questions about the notes from our November meeting? The idea is that they reflect accurately in a summary form what happened. And I wanted to thank whoever we're kind of getting back to our yellow highlights for action items so that we can track those things that somebody said they'll do something about. And there were several in these notes. And I guess we don't really have time to discuss those at the moment, but the idea there is to just hold each other accountable and kind of make sure things are moving along and that we don't forget the things that we've said we'd follow up on. So if you have any questions about those items that are highlighted, please reach out to whoever's mentioned in those action items. And with that, we're going to move on to our breakout rooms to connect with each other before we get on to the rest of our agenda. So.
Okay, so we're doing pretty good on time, not too bad, a couple of minutes behind our agenda. But today's question: in this cold weather, do you like to stay cozy inside or adventure outside? I will send you all to your rooms right now.
I actually love this aspect of our meeting, so thanks everybody hopefully everybody does. It's nice to connect. Yeah, Teresa.
Is that part recorded in this meeting? Because I've never gone back and watched the recordings, but.
No,
is
it's
that-
not recorded.
Okay, I just wondered just now. Thanks.
Yeah,
What did I
we have
say?
no idea what you guys have been saying in there at all.
That's a good thing, really.
And we don't know what everybody else does. What does everybody else do while we're doing that? Do you talk to each other in the main room?
Yeah, it's almost like a
Oh.
mini staff meeting.
Oh, okay. All right, so let's move on to, is Buffy with us? I didn't see Buffy. Buffy, I don't see Buffy.
I don't see her yet. I'm hoping she'll still join. Either we can flip-flop the agenda items, or I'm prepared to go over the share projects.
Yeah, why don't we, was everybody think about just flipping? We'll start with share projects and then hopefully Buffy joins us. Sound okay?
Or end with share projects.
What's that?
You want to flip-flop, so we'll end with share projects? I'm sorry, I don't have the agenda in front of me. Were
Oh,
we
because
next?
she's part of that also. Okay.
Yeah, I'm hoping I can get her via text and have her join us. These are all tribal projects, so I would like that if she could be here.
Yeah.
But if she, got caught up with something else or is sick, like so many people are right now, I am prepared to present and speak about the projects.
Okay.
Actually, I know that today Warm Springs is holding an event for families, something to do with getting kids like free Christmas toys out to the community. And I was previously in a meeting earlier in the month and Buffy attended, so she might be helping out there. I'm not 100% sure.
Okay,
Thanks.
thank you. I'll text her again, and like I said, I'm prepared to speak on them if she's not here.
Okay. Well then, Gwen, are you ready to jump to emerging issues?
Sure, absolutely.
Okay.
Absolutely, absolutely, yeah. So, and then we'll just do a time check and I'll keep an eye on and we'll see what happens because we have about a half hour for this. All right, so emerging issues. Y'all have been working on periodontal and dental work last month. So you've been working on emerging issues to be able to stretch and grow into the kind of the advocacy piece of the role as a community advisory council. And I think we've been attempting it a little bit more consistently over just the last year, so still new. The topic that you've been focusing on most recently is periodontal and dental, which you've done work on. So what I want to do is do a circle back with what's happening after last month with that, because you did some advocacy letters and writing, and then wanted to take some time to step back and look at the broader picture of the tracker. I don't know if any of you remember that. We introduced just a system that we're trying out to both record and kind of follow the work through to what end is going to be different, because we know this is never ending, but to see it progress. And so we're going to take a look at that tracker and make hopefully some decisions on the items that are currently on there, items that we may want to bring up to get a little bit more information before we put on as a large issue you want to tackle, and then kind of go from there. So kind of refocusing. So that's what we'll do for our time together. Anybody remember what we did last month with regards to periodontal, dental, emerging issues? I'm going to turn to you to your memories. You did some writing.
Last month we crafted some letters and personalized letters that we could write on a number of different topics.
Yes. Yeah. We broke them into small groups. Staff had prepared like 3 different templates around the letters that could be used to the HERC within the OHA or different parts of OHA, legislators around dental health, dental and periodontal, workforce development and reimbursement rates. And we all did that. There was a nice combination of individual letters and group letters. And we got those all set and ready to go. So we're going to send out the first batch to HERC, which is the body in the Oregon Health Authority that decides what's going to be reimbursed. So we're going to do our first round there in January. And then the next thought is I'm waiting to hear back on the Medicaid Advisory Committee. They say they take public comment, but with the transition in the year, their calendar is in flux and the contact methodology for sharing that is not live right now. So I'm doing a little research there. And so the next stage we were playing with is doing another mass mailing to our legislators. I know we just went through some elections and it may be good just to let them know what y'all are thinking as just a next step. Lots of other options here, and we're going to be hearing about more of that in their combined CAC and board meeting, I think. So, so any thoughts on what happened after last month and what's happening moving forward in the next month or two with periodontal and dental? Or comments? Just going to open it up for a moment before we step back and look at the big picture. Yeah, Teresa.
Teresa, yeah.
So you've had probably a chance, you and others, to over or review everything that's been written. Do you think it's going to be helpful?
I'm actually gonna,
Okay.
I'm gonna talk to our local expert, Carmen, who's done a lot of community organizing. Do you think letters are helpful, Carmen? Can I put you on the spot? Or other folks who've done this work? There's other, Brad, you've done advocacy with LCA. So other folks who've been doing this longer than we have. What do you think?
I do think letters are helpful. It's just one avenue for doing that level of work. So, it's definitely organizing isn't just something that you do turn on and turn off. It's kind of a way of being and doing, the same, Teresa, as your organization, right? You live and breathe it. And so there's different aspects of just, check box, here's a letter, that's great. But how many of your friends are you also working with? How many people can you have also sign within your community? So there's a larger aspect of it, but, the proof is in the pudding with the numbers always, right? So that's just my quick input on that.
Brett,
Linda?
yeah, go ahead, Brett.
I'll go, Linda, you can go.
I would just add that mass letters that everybody sends to everybody, from my experience as a state legislator years ago, are less impactful than a letter directly from a constituent. And that personal connection with your legislator really is powerful.
And Linda, what about a coalition of consumer representatives? I know it's not the same because you don't get the individual stories, but.
Yes, a coalition is great, and an invitation in the letter to come and meet with the coalition is also effective. And if it's signed if there's somebody in that coalition that lives in their district, that's a double plus.
And then what's our anticipated, what do we anticipate will happen? Will they send us a letter? Will somebody reach out and call? What can we anticipate the next step being once they've received the letter?
Is that a question to me or to whoever? I've not worked with the Oregon State Legislature, so I don't know exactly what their custom and practice is. I think it also depends on the organization of the office. And if the office is really receptive, the office of the legislator, if they're really receptive, they'll respond and they'll have a system in place to do that. If they're not receptive to your issue, they'll probably have a form letter that they send out.
So a lot of times before letters are sent, I agree, Linda, that the constituency voice really matters. And so oftentimes there's sort of a community mapping. Everybody lives within this region. So I would imagine everyone has the same representative. And then from that point of view, oftentimes you would get a legislative assistant where you can actually send that information to. And then, that's one avenue, again, is the letter. But during the legislative session, depending on the energy for this group, oftentimes you would actually make an appointment with your legislator and then talk, have very succinct speaking points as to what the message is and what your specific ask is. And then you would have people go there into that space and speak on the behalf of the group. So that's my experience, what I've done. It's very empowering as a citizen to remind our legislators that they work for us and not the other way around. So again, my 2 cents.
And just to follow up a little bit, we actually, even though our region isn't that big, I think we have maybe 4 different representatives. We are kind of chopped up into different areas. Like Bend has one, Redmond has actually Redmond might be part of Bend, I forget now. But then Madras has a different one, and I think Prineville has a different one. It's on the state level, so.
But that's okay, because if people seems like those areas are similar issues are affecting each area, and we're all dealing with the same problem. So if you got 5 legislators who are hearing the same thing or similar, then maybe it's a wake-up call. I was just wondering if we were utilizing our time very well. So thanks for the feedback.
I think that adds a nice advertisement for the January combined meeting. Carmen's bringing in somebody who has a lot of experience with the legislative session, as well as community organizing experience and like strategy around that. So I think over the next year, you all, along with other bodies within the Health Council, have all expressed interest in advocacy around health related issues and for our region. And so we're going to be traveling that journey together, and the January combined meeting, we're going to be talking more and diving more into that. So exciting times ahead.
Sounds like a field trip in our future.
Absolutely. All right, let's, any other comments on the letter writing before we transition to stepping back and taking a look at like our tracker. All right, and I'm gonna go ahead and share screen. And do a little refresher here. The right screen. All right, so let's make this might seem vaguely familiar to y'all, and it might not, because it's been a while since we've pulled it out. So a year ago, when we started even developing some system around emerging issues, because the historical story, for those of you who are newer or come in midway, is like issues would arise. Something would come in through a public comment, or a member would bring something, and we'd kind of handle it at a personal level, but we didn't know really what to do to elevate it to the system level, because we knew it was a system level issue. So one of the first steps was, okay, we don't have a process, even a beginning process for how to manage these or see them through or make sure things, it stays on our radar from meeting to meeting. And so this is our first attempt, all an experiment, for like recording it and following things along. And so this is what we, for lack of a better term, is called an emerging issues tracker. So not every patient story is an emerging issue. Some are. Emerging issues can come from other areas. You all defined it earlier this year around things that affect, care. It could be system level, it could be access, like a variety of things. But it was definitely part of the CAC charter, who you are as as a community advisory council. Let me give you a quick overview of just the spreadsheet that we built to help staff and y'all keep things moving forward. Is that, so what we did was this is a column for the date of things that may have come forward in conversation or through a meeting. A high level statement about what the issue is, which member or where that came from. And then from here, we looked at like process steps along a process around the specific item, around, well, we need to know more. How sizable is this problem? Is it a one-off? Is it happening across the region or one area? Is it clinic-based? So just gathering some information. And then bringing it to you all to review the information and then reflect on it to say, hey, we have this, what does this mean now? And what does this mean to us as an organization, as a community advisory council? And then to make a decision, is this something that we want to move forward on as a body? Do we want to use our meeting time and our off time to take action? And then, you know, acting, whatever that may look like. And that's a whole strategy, as Carmen has kind of alluded to, that we're still learning about. And then simply, you know, monitoring it. Are we still moving forward on it? Is what's happening? And then is there an outcome that comes forward? So all that being said, the full reflection is we've never done this before. This is a first attempt. But what I want to bring to you all is some of the items you've been talking about and working on periodontal and dental for the last year and a half, a little bit more focused in your meeting times. And there are a couple other items up here as well that we just want to refresh and see where, if you want to broaden your interest, keep it focused, that kind of thing. So the staff know where to start working or continue working to support you in this. All right, so questions about the tracker itself? Is it just clarity? Don't worry about the content yet, is what I'm thinking. But did what I say about the tracker and the process make sense? Are there questions I can answer with that? Because the next place I'm going to go to is we'll actually look at those, do a little refresher on the issue topic and refresh what each of those meant. And I'll pull on those of you who offered, and then we'll have a little discussion and do a real informal poll about where you might want to focus.
Hey, Gwen.
Brad, I saw you. Yeah.
Yeah, I think it was reflection, one of those columns that's not clear to me. It said something like responsivity, something. Could you explain that column?
Yeah, I think the way we designed it, and there was a small group that worked on this, a small group of you, Brad, you were part of it. I think Linda came, Mandy came in and out. So there was a small group that kind of worked to develop this. Let me share. And I think we were trying to identify, let's see, on Reflect. Hold on, I'm changing screens to get into the detail. What were the reasons? Like, what does it tie to? What's the issue tied to? Is it tied to equitable access, responsivity to needs, consistent care? These are three, incomplete, but it was just kind of gave an introductory guideline for like why, what does this tie to with our greater vision?
So at least for me, I think that we could come up with a different column heading. For some reason, those don't even connect for me.
Yeah, and this was like
The
very
word
much aware of that yeah. And that's super aware of that because this was our first attempt and we really didn't know what we were building yet. And so I think as we go through this again, we'll better understand if this is even the right tool. I don't want to spend time, I would rather we not spend time on that today, but rather looking at the topic areas. So any other questions before we jump into kind of the quick refresher and a poll? All right, so I'm going to share screen again, and we'll do our best. I'm going to pull on you all to help refresh on the topics, and then we'll go from there. All right, so the areas we know we've been working on, periodontal and dental, those are green. That's why those are green. And then a couple of the other issues that have been doing a little bit of work behind the scenes or no work behind the scenes is the chiropractor services are not covered by OHP. This blue one. Reviewing the grievance and appeals process and concern about low participation of members and how that might be used. And that came up through CAC. And then last month you heard from some community folks around non-emergent medical transportation and challenges with that recently. So my question, let's start up here, Brad, in an elevator speech of a minute or two. Can you kind of summarize this issue for us to your level of understanding at this point? Because we know little pieces of anything. So
So basically it was a personal experience with my son and our chiropractor, and the chiropractor not accepting OHP. And so it just raised the question, like, why? Well, yeah, they didn't accept OHP for that service. And I apologize, but at this point I forget kind of the details of what they said. Krista did a lot of research, got information back, and it's not true. So I want to clarify, it's not true that chiropractic care is not covered by OHP. So that's not actually like a statement. It was more that a particular provider in this case didn't accept it, and why not? And that provider had kind of said, that provider had told me that they submitted it, like they were trying to get it covered, but it wasn't being covered by Pacific Source, so the CCO. So that was apparently not actually true. And there's a lot of details in there that I won't go into.
Great, thank you, Brad. So, perfect.
I will say though, the chiropractic coverage is limited. It's not, it's pretty much limited to kind of back pain, things like that. So that definitely is a true statement that what OHP will cover as far as chiropractic care is limited, based on essentially a few codes around back pain.
Yeah. So all that being said, without going any deeper, the question, I'll just prompt you, do you, based on this very limited information, what we're going to ask in a moment after you've heard the other two is, do you want to start digging in to any of these and which ones? So, I don't want to I want to go ahead and hold off and move on to the other one because we just have a few more minutes left before handing it over to Buffy and Kristen. All right, the next one, I'm going to share screen again, is around the reviewing the grievance and appeals information. So this was a part of a conversation. I'm going to ask folks to chime in. As we can see, it was a while ago. However, when we look at our notes, the concern was that there aren't as many grievance and appeals as one might think, and that you all want to explore what it's like to do that process as a member. One of the responses was, and this was like a long time ago, Pacific Source had put together a video covering everything from what a grievance and appeal is, so basic definitions, to how it works in really nice plain language. So that's the last time you've seen that. Any other information that folks remember from that early conversation that you'd like to add? to people's understanding of it at this point.
I would just add that I think we expressed that we would like to kind of hear from Pacific Source about, get data like quarterly or every so often, just so that we're staying up on that and kind of tracking it.
Mhm. Okay.
Teresa has her hand up.
Maybe this is premature, but I think we should pursue it because in theory, and no one knows this, that you request something, if you're denied, it's based on every OHP person. And a grievance is the process where it gets individualized. But there's a lot of grievance in my experience that the ball is dropped. And you get denied, but there's no follow-up, and there's like, we'll contact you in 31 days. And I've never heard from anybody when I filed a grievance. So
Okay.
Anyway.
Thanks for sharing. And you'll be able to, we'll do our poll and then probably next month come back with some follow-up and conversation around where we're at. And we'll see it right after poll. Thank you. All right. And then the last one, share screen again, was the non-emergent medical transportation down here in Orange. Elaine's not here. I'm going to pull on a staff member or a CAC member to help refresh us on this one. Michaela, can you help us out?
Sure. From last meeting, and I think Kristen, you probably have more information than I do, but there was some issues with transportation, CCO members not being picked up by the entity providing the benefit, the non-emergent medical transportation. I think we discussed a lack of drivers. Kristen, fill in some more.
So our biggest grievance is related to non-emergency medical transportation. And it kind of has been since people started going back to doctor's offices to be seen after COVID. And the Motive Care, which is a transportation brokerage that we contract with after Cascade East Ride Center decided in 2020 that they our local ride center no longer wanted to hold that contract. So we now have that with like a nationwide brokerage, and they've really, really struggled to hire enough drivers post-COVID because they had to lay off a huge amount of drivers when people were no longer going physically for appointments early in COVID.
Thanks, Kristen. Okay, so now that you have this, go ahead, Linda, and then I'm going to move us towards the poll because we're just about out of time.
Just for the future, one piece that I've noticed, I know I have my name down here and I did follow through, but I'm not clear on how we report back to the group the outcome of our conversation on an emerging issue, whether we do that at the next meeting, whether we do that in writing through the staff. So just to give a quick update, I have that action item to talk to Tammy Bainey, and Tammy and COIC with the prior contractors. So when I shared with her that we were having some dissatisfaction with Motive, it was sort of good to know. I don't have any suggestions other than that's work within the contract. I think it's a big enough issue because it impacts not just OHP, but seniors and anyone who needs non-emergent medical transport, insured or not. So I think the issue is big enough to continue to pursue. And I guess my gut says we have a contract and they're not meeting the expectations. Then at some point, we sit down and talk with them. Sounds like Pacific Source has done that, and we have their explanation of why. What I haven't heard yet is what they're going to do about it, and if the conditions are difficult enough that it's worth reconsidering the contract.
All right. Thanks for the added information, Linda. Appreciate it.
Thanks.
Yeah, okay. So based on this very limited information that we've gathered so far, I'm gonna have Kelly put up a poll. And I'm gonna ask you all to select 2 of the emerging issues that we've outlined that you want to continue or start. So the first one, of course, is continuing with periodontal and dental, which, you know, we'll continue what we're doing and building it out. Starting to look more into chiropractor services, starting to look into the grievance and appeals process, and or starting to look into non-emergency medical transport. So I'm going to ask just the CAC members, not guests, to complete this. So just CAC members to complete this and hit submit. And then in just a moment, Kelly will show the results, and that'll give staff some direction for the coming months.
I would like to say that
Without button. And
all about 5 years, I was involved with non-emergency medical care. I went to all those meetings. I think I missed 2. Vicki Ryan was very involved in that, and Lindsay Stalling. And we just quit meeting, you know, when it all stopped. But those cab drivers have the issues. Now, I don't know who this national contact is with, but they don't get paid if they go and the patient doesn't come out and ride. They don't get paid. And they have a lot of other issues. Like there they are 2 feet away from someone, not that far, and the person has an emotional breakdown. And there they are driving a taxi, and they get some emergency training, but they're not psychologists, you know, and they've got someone breaking down, you know, so close. And just, you know, you hear all these stories. And so they have their side of the story. That's all I want to say.
absolutely. And we learned that with dental and periodontal, that the providers have, you know, they've got their pressures too. So Kelly, I'm going to thank you. And so we kind of see what some interests are. So it looks like continue with periodontal and dental, dive into the non-emergency transport and see where that comes from, followed by grievance and appeals process. And then I'm following along in the chat some of the earlier conversation that wasn't caught around eyeglass prescription filling times between private and OHP. And I see that Kristen's going to just bring us back some starter information so we can add that to the list too. All right, so thank you, everyone. We will continue this conversation next month. As always, it's unfinished business because this is ongoing work. And we'll be taking it to a new topic, continue the previous, and increase our learning around advocacy. So thank you, thank you. With that, I'm going to turn it over to Brad.
Thanks,
for the rest of
Gwen.
the meeting.
Thanks, everybody for participating in that. What looks like Buffy, you are now with us, so welcome. And we will turn it over to either yourself and Kristen to discuss tribal learning and the share projects. You can do that in any order that you'd like. So the rest of the meeting is yours.
Hey, Buffy, I know you're driving. Do you want me to start?
I just had to find my unmute button while I drive.
Oh, sure. Yeah.
So no, I found it. Hi, everybody. Sorry, I'm not on camera, but as usual, I'm in motion. But I think I'm happy about that. I guess the person that's in motion stays in motion, right? So Kristen, do you want to kind of give them, I don't know if you have visuals or not, a breakdown of kind of how this conversation is going to unfold?
Sure. So we have a separate pool of money from the community health projects that you all invested this year. And you might remember it's from last year, those of you that were on the CAC, it's called Share Initiative. And those funds come from the overall CCO's profit at the end of the year. And so last year we had $280,000, just shy of $280,000 to invest. And Buffy and I worked with, well, we offered funds to each tribe in our service area, which would include the Confederated Tribes of Warm Springs, the Klamath Tribes, and Cow Creek Band of Umpqua Tribe of Indians. The Confederated Tribes of Warm Springs wanted to participate. And so we started going and meeting with people within Warm Springs. It was very different from an application process that the CAC has kind of done over the years. It was more going and listening to hear what the needs were, and then helping write and adjust the share plan to both meet the needs of the tribes and their priorities, but also the OHA requirements, which sometimes don't always line up is, you know, super well, right? And so it's been a really interesting learning process for me. And Buffy, did you have anything to add? Otherwise, I thought we could just sort of talk a little bit about the projects. I have a few pictures to share.
Yeah, so part of why I wanted to discuss this with the CAC not only is just for sharing and celebrating, but also to begin to continue the conversation about what is tribal engagement, how does that look, why do we do it, and how do we do it? And so, as Kristen said, an invitation in order to participate supports sovereignty and self-determination, because what this does is acknowledge that not only is there a reason to invite somebody to participate, you're giving them a choice. You're saying in a way that they understand, here's what we would like to do, and we don't know what that's about, but would you like to explore it with us? And what this does for tribal communities is that it acknowledges that there are differences and we want to meet them where they're at, and we want to learn and understand moving forward about what we're going to have to do on our side of things in order to ultimately support them where they're at. So in this case, Kristen's correct. It was a lot of showing up inside the community and meeting people and listening very carefully, not with guided questions, not with a form, a checkbox, a list. It was actively being inside the community, doing what they do and paying attention intentionally. Kristen and I discussed about how many hours we felt like we had under our belt before we first began to really understand, you know, is this what the community is really saying that they need? Because we're coming from the people, not those decision makers necessarily inside the organization, but more the people. And so we calculated anywhere between 30 to 40 hours of just spending time with the people of Warm Springs. And then once we did that, we were able to kind of come back together and say, okay, these are kind of some of the themes. That's then what we took towards those spaces of leadership to get more clarification, to get more information. And as you will see, some of these projects, because of what we did, those voices that came out were really different. So I'm going to stop right here and go ahead, Kristen, go ahead. Why don't you start to get into some of the projects?
Okay, so I was going to start with this Warm Springs Skate Park project. I'm going to share my screen. We have some before pictures. And Buffy, correct me if I'm wrong, but a mother in the community approached Buffy about the Warm Springs, the existing or the previous skate park, and told Buffy, this is not safe. The ramps are, they need to be resurfaced. And it's just kind of not really usable to where the people using the park started to hitchhike to other communities to use their skate parks. And I mean, we all know how dangerous hitchhiking is. And so then Buffy connected with a larger organization called the Skate Park Project, which came about through Tony Hawk. And essentially they invest in building or renovating skate parks in rural communities. And so I'll share.
Kristen?
Oh,
Yeah.
yes.
Kristen, let me kind of expand on that. So you have to understand that in a community in Warm Springs our size, the skate park has been an ongoing conversation with all of those individuals who have basically children that access it. So for about 5 to 10 years, and I'm not even joking, we've often had community mothers, if you will, and guardians saying, how can we get a better skate park for the kids? And so when I took this job at Pacific Source, the conversations were always, Buffy, can you figure out how to fix this? Buffy, can you fix this? And me trying to say, well, I don't even know what it costs. Let's look at it. So on the sidelines, this is the community conversation. However, simultaneously, what happened is that the Confederated Tribes of Warm Springs actually was the ones to contact at that time Tony Hawk's Foundation plus Roundhouse Foundation in order to figure out how to build a skate park. At this time, Tony Hawk had no idea about what it meant to build on sovereign lands. And so they began as an organization to just explore what that looks like. Now, when Buffy enters the conversation is that when a person who is part of this conversation knows me personally, they said, hey, Buffy, we have a problem here. So that's when I began to learn about all of the skate park, all of who was involved. And I said, oh, I think we could maybe help, because they had original investors who pulled out of the project. And so what I did from that point was basically began to work closely again with the tribe, work with the parents, work with all of the players to make sure that this happened. And as a result, we were actually able to do more that was necessary in order to keep our kids safe. So that's kind of, and it's even bigger than that, but that's it in a nutshell, if that helps.
Thank you for sharing more of that history. I'm sure you had shared that with me too at one point. Okay, so I will show just a few pictures of what the park looked like when Buffy and I were there a few months ago. So most of the equipment that was like in disrepair, the ramps and things like that have been moved. But this is sort of where the space is. Another view. So all of these ramps that are left here will be resurfaced and moved to Simnasho, which is another area of the reservation for the youth there to enjoy. So that'll be a project probably down the line to see if that area might be interested in a more permanent skate park down the road. And then just another angle there. And then this is sort of the original project overview. And I was going to zoom in on this. Is that the park, I'm sorry, it's going to get a little blurry, is ultimately going to be this. So as you can see, there'll be the kind of a lower speed area for people new to skating, and then an area with more advanced and a faster speed, I guess. There's a parking lot here, and I believe there was also restrooms there near the parking lot.
Yeah,
And
they're kind of to the west side. They're restrooms and showers.
oh, okay. And then they'll also be constructing a permanent shade shelter. So there's protection from the sun and the elements. So we're hoping, I think that they're planning to break ground sooner than later. So once we have a grand opening, we'll share that date with the CAC. Oh, and then the other piece is that it is probably the coolest part, or one of the coolest parts, is that we're also going to purchase Warm Springs Skate Park t-shirts from a company called GNU, and it's a native-owned, native artist business. So we'll be purchasing shirts to give away at the grand opening, and then helmets, pads, and skate decks that are designed by a native artist named Stephen Paul Judd. And Buffy was a little starstruck, I think, when she got to talk with him. But so that's also really exciting that we'll be able to support native businesses and native artists as the skate park sort of has its next life.
Oh, Kristen, I actually just got the photos of the skate deck. I can text them to you if you want to share them.
Oh yeah, I'd love that. I should have pulled up the t-shirt. But anyways, so that part was really exciting too. So when I get those, I'll figure out how to share them real quick. I'm gonna stop. Oh wait, actually I had one other picture to share. It's just a different angle, sort of. So this was the original project proposal, the skate park project proposal. And this was the ramps and sort of what they looked like before in the temporary skate park. So again, these will all be resurfaced and moved to Simnasho. And then the existing skate park will get permanent concrete fixtures, tricks, ramps, I don't know, whatever they call all of that stuff. So that was the first project. And I don't have pictures for the other two projects, but we'll have pictures down the road. So the next project, Buffy and I went and sat with the Warm Springs Housing Authority and asked them about their needs and their priorities. And they shared with us that they had a need to build a storage facility to keep their equipment, lumber, and things like that. And to build that on a different, an area of the reservation separate from agency, which is the area where like Indian Head Casino, 97 sort of drives right through agency. They'll be building this in another area of the reservation, which will allow the Warm Springs Housing Authority to have their equipment and their lumber, tools, everything that they need more accessible instead of having to drive sometimes 2 hours back to agency to get something that they need to go back to Simnasho or another area of the reservation. And so some of the share funds will be used to build that storage facility, and that will free up funds so they can build more housing, because right now a large percentage of the budget is having to go to gas, just time on the road, you know, and just all of those wear and tear, having to haul stuff back and forth across the reservation. Buffy, do you have more to add?
Nope. I think that housing is such an issue, and anytime we can save money and make it more efficient, then I'm all for that. And also, I think the only thing I'll add, Kristen, is that because of the facility being purchased and built, basically, is that they'll be able to now buy in bulk versus getting materials for just a few projects at a time, which is going to definitely impact their bottom line.
And then the last project, Buffy had a tribal council member approach her and let her know that the Simnasho Fire Hall needs critical upgrades and repairs. And it's just an older building, and it's just kind of over the years, things start to kind of fall apart. And so he was able to provide Buffy with a bid from the Warm Springs Construction Enterprise to basically fix that facility and make it operational again. That space also serves as a central location for distributing water, food, any kind of like emergency supplies. That space is also a gathering place. Like if they're going to have like penny carnival games or a parade or something like that, that would be the location that the families would meet to start or to participate in the carnival. So it's more than just a fire hall. It's also a community space. And it also houses the first responders. So having the fire hall fixed will allow them to stay there again, to respond to medical emergencies faster, to respond to fires quicker. And when I was doing some research on rural fire departments, it's very clear from studies done by like HUD and FEMA that people living in rural areas are at much greater risk from fire or medical emergencies because of rural fire departments over the years falling into disrepair. And so I read a pretty extensive article where they visited all of the fire stations or fire halls in California. And just the need to really invest in those rural fire stations and how important it is to those rural communities, because if you're out in Mitchell or something like that, the closest hospital is going to be several hours away. So and maybe the closest person to respond to a house fire, wildfire. So having that fire hall fixed is going to protect the infrastructure, housing, and people living in Simnasho.
And I think the only thing that I'll add here for a CAC moment to understand is that when you as an individual have leadership come to you and share with you their concerns and their issues, one, you're beginning to solidify your relationship with that tribal nation, but also they're trusting you and believing in what you're saying. And so I really shared with Kristen how important this was, because what resulted is I now have 4 tribal council people talking to me about just the needs and the gaps that I don't think that we would have been able to see otherwise, with just being able to say, hey, we have this application, would you like to fill it out? And, would you like to, apply with everybody else? No, what we were saying is we don't know if we have the resources, we don't know the answers, but what we're willing to do is listen to it and try to figure out together, how do we advance solutions for the Confederated Tribes of Warm Springs in this situation? And so just being able to kind of share these things are examples of how we as I guess maybe outside support, if you will, can look at where do we need to adjust our approach when working with tribal nations and tribal communities.
Thanks, Buffy. Kristen, did you have anything else, or is that?
I'm opening up that picture really quick of the skate deck. Give me just one second.
Okay. And then also, if there's any questions, Brad, you already know that I am all ears and willing to help the CAC in any way I can.
Thank you, Buffy. Appreciate it. So Kristen, did you say you're gonna pull up another, you're trying to get it from your phone to the, yeah, I still don't know how to do that very well. Get a picture from my phone to the computer.
I might
Um,
have to, let me see if that'll work.
Well, while
Yeah,
you
it
do that,
didn't, yeah, go
oh,
ahead.
does anybody want to open it up for comments, questions about what Buffy and Kristen have shared? Linda?
I have just two quick thoughts. The first one is on the first project with the skateboard park and the artists in the t-shirt designs. I'm certain there may be some visual presence at the park, a poster, a sign, something like that. If we could incorporate that artist design into a branding for the park, that I just think that would be a sweet idea. The second one is more significant, and I just want to acknowledge Buffy and Kristen for not only being who they are in creating community by listening, but also being great instructors to us about how to move into any community, but specifically the tribal communities, not with our agenda, but listening deeply for their agenda and creating trust in that listening. And from there, as Buffy said, people start to approach you and say, well, our priorities may be in this direction today, but I think you have something I might need, and to start that relationship.
Thanks, Linda. Anybody else? Myra, Karen, Miranda, Tom, Stacy, Teresa. Well, I'll jump in. Buffy, do you foresee a tribal member becoming a member of the Community Advisory Council? A consumer representative from the tribes?
Yeah, Brad, thanks for asking that. I always look forward to that. I again approached the Health Council in saying there is a need for a tribal engagement plan for Central Oregon Health Council, and that in 20 and 23, we really need to lean into that work and get it in a way that is lined out, because we do have these goals ahead of us. So in 5 years, absolutely, Brad, I can envision that. But right now, the work that needs to be done in order to make that a safe space, a respectful place, and one where they feel like their voice is, I think we need to do the front end work of that. And I think we're moving towards that. Absolutely, every single day. And I think that when we get there is when we'll get there. I think we're going to need to evaluate along the way about what do we need, those checks and balances. But that's my goal, Brad. That is so my goal, because everything that I'm telling you guys, when you listen to these stories and when you meet the people and you hear truly what's necessary, it is one of the most rewarding things out there, is to know that I've told you guys before, the decisions you guys make are so important. And so yeah, I think so.
Good. Well, I guess I would just if we're correctly assuming that we're leaning on you to let us know if we're progressing in a good way or if we're dropping the ball. I just don't want to drop the ball. But I also don't feel like it's in our, control necessarily to move forward.
Right, Brad. I think it's a lot of things. I think we're trying to figure out, like, how much do I, what do I need to begin to do to help the CAC members, but also the Health Council staff. It has to be a priority within the Health Council, and it has to be solidified in a way that is a priority. And so I think that that's kind of where I'm beginning, is to be able to say, okay, let's go to kind of the root of this cause, this opportunity, and let's figure out how to build out. So hopefully in 2023, this first and second quarter, I'll be able to come back to the CAC with a plan and maybe some opportunities to do some shared learning.
Fantastic. Well, thank you. Thank you. And we
I have
are
the
at the end of-
picture to share really fast.
Okay, go for it.
I figured it out.
Oh, nice.
Yeah,
And what does it say?
I'll
I'm
have to
sorry.
ask Buffy what it says.
SHITA.
It says Shatike. So
Shatike.
Shatike Creek is the creek that runs right by the skate park. And I know what it looks like. When I looked at it, I had other people looking at it and there were community members. And the first thing they said was, Buffy, why does it say shh? And I just laughed and I said, it doesn't say that. It says Shatike.
Oh, that's pretty cool. Well, that's exciting. That's a really exciting project.
And we'll be back next year with the completed pictures of the skate park, the fire hall, and the storage facility. So we'll provide updates on that next year.
All right.
Thank you.
Yeah, thank you. And that brings us to the end of our time together and the end of our year together. So everybody enjoy the holidays. I'm pretty sure we can close up if nobody else has anything you want to add before we part. Yeah, enjoy the end of the year, get some rest, and recharge for 2023. We'll see you in the second week. Bye, Buffy.
Hi, everybody. Happy
Bye, everybody.
holidays.
Bye. Take care.